Hi, my name is Solange Gomez, and my topic is advancing the understanding and use of a continuous glucose monitor in exercise, sport, and nutrition. Definition: blood glucose monitoring is the use of a glucose meter for testing the concentration of glucose in the blood. A CGM works through a tiny sensor inserted under your skin, usually on your belly or arm. The sensor measures your interstitial glucose level, which is the glucose found in the fluid between the cells. The sensor tests glucose every few minutes. A transmitter wirelessly sends the information to a monitor.
Or glucose, is an important and ongoing part of managing diabetes. The standard has been intermittent finger prick testing, but for some, it's not enough. There's a wide range of circumstances where frequent or continuous monitoring is beneficial. That's when advanced glucose monitoring systems make sense. Advanced glucose monitoring systems can help people with diabetes and their healthcare team better stabilize blood sugar levels, reduce complications, minimize the risk of emergencies, and improve quality of life. There are two types of advanced glucose monitoring devices: Flash GM and Continuous, or CGM. Flash GM users can scan their glucose at any time. Devices present trends and patterns that guide decisions about food, activity, and medication. CGM does all that and transmits glucose readings regularly to a receiving device that can also be viewed remotely and securely by a caregiver. An alarm is triggered when glucose is trending too low or too high. Advanced glucose monitoring systems can benefit some people with type 1, type 2, and gestational diabetes. Both systems can be monitored remotely and securely by the patient's healthcare team. The devices may be ideal for those who struggle to prevent severe high or low blood sugar, who require caregiver support, who need to monitor multiple times a day, or who have diabetes and are pregnant. For some people with diabetes, advanced glucose monitoring devices provide life-changing benefits. The choice of glucose monitoring system depends on individual needs and should be made in consultation with your health team.
Applications in nutrition. There is no ideal diet for everyone, but a continuous glucose monitor gives you real-time feedback on the foods that work best for your metabolic health. Glucose levels and how they change over the long and short term have a great deal to do with the health and well-being. Diet is the most significant determinant of our blood sugar. Chronic elevated levels and post-meal spikes can lead to serious dysfunction, including increased risk for diabetes type 2, cardiovascular diseases, stroke, obesity, and more. Pros: it's essential that athletes monitor their diet to maintain and increase muscle glycogen deposits, and they are a major limiting factor of prolonged exercise performance. Now the cons. The glucose measurement that we obtained for the CGM is somewhat more inaccurate than the blood glucose measurement, in addition to being 10 to 15 minutes later than a normal glucose test.
Did you know you can lower diabetes and heart disease risks by controlling your blood sugar? Heart disease and stroke are the #1 killers among people with type 2 diabetes. Blood glucose, or sugar, is an important fuel for your body. When it's at the recommended level, that's normal. But when it's too high, that can lead to diabetes. Insulin is a hormone that is important for controlling blood glucose levels. But if your glucose levels become too high or too low, your body can have trouble producing a hormone called insulin that it needs to stay healthy. When your body doesn't produce enough insulin, or it doesn't efficiently use the insulin it makes, your blood sugar may become too high. When this happens, your body's cells cannot use the sugar in your blood, and the cells can be starved for energy. Over time, high blood sugar levels can damage your eyes, kidneys, nerves, or heart. You can lower your blood sugar by eating better. Eating a diet full of fruits, vegetables, whole grains, low-fat dairy products, poultry, fish, and nuts, while limiting sugary foods and beverages to promote a healthy lifestyle. Finally, always remember to talk with your own medical provider to discuss the best plan of action for your health.
Issue applying in Ecuador. In Ecuador, public health is very delayed and difficult to access. With high glucose levels, you need to go through several doctors so that at the end, you will be sent to an endocrinologist. Constant glucose monitors are expensive in our country, so not all the athletes can have one. However, there are other options for glucose monitoring in our country like blood glucose measurement or oral glucose tolerance tests, and others.
Fluctuations in glucose can have a tremendous effect on your performance, from hydration to recovery to endurance to fatigue to cognitive function to response time.
A lot of people are very unaware of the effects that nutrition has on them. Being able to track your glucose levels can change a person's whole entire diet.
It's really interesting because you get your little green circle or your red circle, and if I just have a snack of something simple like an apple, I really see these super high spikes I didn't expect to have. If I just add a little bit of protein or a little bit of fat in whatever I eat, I stay level all day. It can be super rewarding when you have all those green days lined up.
If we can give the insight necessary to optimize the nutritional aspects of every individual we work with, we can change a human being from the inside out and focus on training high-level athletes from around the world. And we're the only private organization that runs professional teams, like the Detroit Red Wings.
Finally, we have the conclusion. The effect of carbohydrate intake on athletic performance mainly depends on the characteristics of the exercise, the type and amount of carbohydrate ingested, and the time of intake. Checking for hyper or hypoglycemia by monitoring their blood glucose levels is important to treat with additional carbohydrate intake. A combination of these factors must be taken into account when analyzing individual athletic performance.